you struggling with pain and reduced mobility in your joints? Did you know that there might be a simple musculoskeletal cause of your pain? Let's take a closer look at these causes, symptoms, and ways that you can gain relief most quickly. Hi, I'm Alexis Weidland, osteopath, co-founder of BlossomingMe and Healthy Learning Lounge. Joint pain can be a real obstacle, slowing you down and making you feel even that the simplest tasks is daunting. While many people immediately think of arthritis when they experience joint pain, the reality is that there's a number of musculoskeletal causes that can often go overlooked, and these causes can be just as impactful, and understanding them is key to finding relief and getting you back to the activities that you love. Common musculoskeletal causes: injuries, trauma, and overuse. When we think of joint pain, injuries and trauma often should top the list. A fall, a twist, or a direct blow can cause significant damage to our joints, leading to pain and restricted movement. However, overuse is another major player, particularly for those who engage in repetitive activities or have poor posture. Over time, these activities can lead to wear and tear on the tissues surrounding the joints. This will result in conditions like tendinitis, tendinosis, and bursitis. How might these present? Injuries and trauma often cause sharp, sudden pain, swelling, and difficulty moving those joints. Overuse tends to be a gradual onset of pain, often accompanied by stiffness and swelling. It commonly affects areas including the shoulders, the elbows, the wrists, the hips, and the knees. An osteopath could help by assisting with body alignment, relieving pressure on the joints and tissues, and supporting the healing process. A regular massage can alleviate the tension caused by overuse and support recovery from injuries by improving circulation and reducing muscle stiffness. What about postural misalignment? This is often a hidden culprit. Poor posture is more than just a bad habit, it's a common cause of pain. When your posture is off, it leads to misalignment in the body. This puts extra stress on the muscles and the joints. And over time, this can cause chronic pain, particularly in the spine, hips, and knees. Signs of postural issues could include things like pain that worsens with prolonged sitting or standing, discomfort in our lower back and our neck and our shoulders, limited range of motion in our hips, lower back, neck, and shoulders. Osteopaths can assist with your posture, helping to identify any underlying strains that are contributing to your poor posture and to your pain, as well as reducing the strains present in your body, allowing for better alignment, and then add exercises to help you to strengthen your muscles, allowing you to stay in that better alignment more easily and comfortably. They can assist you to improve your posture with awareness and ergonomic assistance. This can help to realign your body, increase your mobility and your joint motion, reduce your pain, and prevent from further issues such as from falls or from overuse injuries, as well as osteoarthritis. Here's a practical tip. Practice good posture throughout your day by avoiding arching or hunching your back and shoulders. Try to keep a neutral spine, and when you're sitting, make sure that your knees are slightly lower than your hips. As well, keep your feet flat on the ground. Take regular breaks from sitting by stretching, walking to the bathroom, going to get a drink. These can all help to reduce muscle spasm that occurs when you're still for too long, especially if you're sitting in a poor posture position, which puts more pressure on those muscles. It gets your circulation moving again, and it helps you to reset good posture regularly by becoming aware of the posture that you are performing and having another chance to position yourself. Muscle imbalances. When one muscle works overtime, muscle imbalances have to occur, and these certain muscles become overworked while other muscles will become weakened. These imbalances will cause improper movement of those joints, leading to pain and increased wear and tear, as well as potentially more injuries. Common areas that might be affected with this would be our hips, our knees, and our shoulders. This can occur due to inherent weaknesses, a weakness caused from a previous trauma or injury, or from poor posture. Some of the symptoms of muscle imbalance would be pain that shifts from one area to another, tightness in some muscles coupled with weakness in others, joint instability or cracking, clicking, weird sounds during movement, with or without joint restriction. Osteopaths can help to identify and correct muscle imbalances by addressing the root causes of these issues, whether it's a misalignment or an overcompensation due to a previous injury. Massage therapy can complement this really well by increasing circulation, relaxing the overworked muscles, and encouraging a better balance of your whole body. It can be really helpful to incorporate exercises that help to strengthen your weakened muscles and to stretch your tight ones. Doing this routinely for a couple of minutes every day or a few times a week can really help to restore your balance, reduce strain on the joints, and improve your mobility and your comfort. Then there's repetitive movements. Repetitive movements, whether from work, sport, or daily activities, can lead to micro-trauma in the joints and the tissue surrounding them. Over time, this will cause inflammation, pain, and even conditions like tendinitis, tendinosis, and bursitis. Repeated stress on these same joints and tissues without adequate rest or without varying the movement often enough is often the underlying cause. How does repetitive movement cause pain? Well, these microtraumas lead to inflammation in the joints or the surrounding tissues. Overuse injuries like tendinitis will develop, causing chronic pain. Continuous strain will accelerate our joint wear and tear, leading to degenerative conditions. So osteopathic treatment can address the misalignments caused by repetitive movements, release the tension on the tendons, the ligaments, the muscles, and the joints. Massage therapy will help to alleviate pain by improving circulation, and this can reduce inflammation and pain. Taking regular breaks from a repetitive activity to stretch or to move differently can really help to reduce the buildup of strain and to protect your joints. How about joint instability? This is when our support structures fail. Joint instability will occur when the ligaments, tendons, or even the muscles that support a joint become damaged or weakened. These can lead to excessive movement in the joint, causing pain, swelling, and a higher risk of injury. Common causes of this would be repeated strains or sprains and previous other injuries that have not healed properly. Recognizing instability. There could be a feeling that the joint is about to give out during movement or standing. There could be swelling and pain that happens after physical activity, and there could be difficulty maintaining stability during certain movements, like when you're walking or lifting. So an osteopath can help to stabilize the joint by improving the alignment of it and the activation of the muscles surrounding the joint and the connective tissues in general. This not only reduces pain, but it also enhances the joint's overall stability and mobility. So strengthening the muscles around an unstable joint can help to provide better support and therefore reduce further risk. You need to focus, though, on low-impact exercises that will build muscle without putting too much strain on those affected joints. So it's important then to understand the full picture of your joint pain. Joint pain isn't always due to arthritis. Sometimes the cause is rooted in our muscles, our connective tissues, our posture, or repetitive movements. By understanding these musculoskeletal factors, you can take a more comprehensive approach to treating your pain. Whether it's through osteopathy, massage therapy, general lifestyle changes, addressing the root causes can help you to find a lasting relief and improve the quality of your life in general. So that's it for today. Did it raise any questions or aha moments? If so, I'd love to hear them, so please put those in the comments section. I love answering questions. I hope you found today useful, and if you know someone who could use this information, please share it. Remember to comment, like, and subscribe. Until next time, and in health, bye for now.